Terry Cheney. I am a coaching client of Dr. Joe Woods, and I wanted to give you a little brief information from my standpoint. Dr. Wood and I met in 2008. We were both part of a chiropractic business forum, and during the course of that weekend, Dr. Out West had put a post up on the forum board that talked about overweight patients and damaging his equipment, and he went on to call them lard asses and a couple other unfriendly terms. And I got very triggered by that and kind of blasted off to him about it on the forum. And then at one point I shared my own struggles with having tried to lose weight, even having prepared for gastric bypass in 2005 and 6. I jumped through all the hoops, and my insurance company came back with, since I had not had a significant cardiac event, that they deemed the surgery not medically necessary. I know, ridiculous. And I had been on and off trying to lose weight myself, and I'd lose, 20, 30, 50 pounds, and then put it all back on, which is what happens when you try to diet instead of altering your lifestyles. So in September of 2008, I was really in a very dark, down sort of place, and Dr. Wood offered his services. He sent me a private message from that board saying, I'd love to talk to you, I'd love to help you. I've been where you're at, not quite as heavy as you, but I've had to lose a lot of weight on my own to save my knees and my hips, etc. Send me your phone numbers. Well, I sent him an email with my cell phone and my home phone number in it, never dreaming I was going to hear from him. And I swear about 20 minutes later the phone rang, and it was Dr. Wood, and we talked for probably a good 2.5, 3 hours that night, and really sort of started putting my life in perspective. And I joke around with people, but it's not really such a joke, that in the course of losing 350 pounds, I found me, and I found out who I was and what I'm about. And I've now become a coach of my own. I'm Coach T, founder of Goddess of Light Coaching Ministry. But one of the things that Dr. Wood and I worked on was, in finding myself, was being able to settle myself. And one of the things he taught me was this breathing technique called Qigong, and I always pronounce it wrong. He's going to correct me tomorrow when he sees this, I'm sure. And it's a really great technique where you physically pull the air into your abdomen, and then release it slowly, and then continue to do that until you've settled yourself down. And because you have to think about how you're breathing and how you're pulling the air in and getting it far enough down in the abdomen, it sort of shuts your brain off to everything else. And I found that that was helping me somewhat fall asleep. One of my big issues had been that I never slept really well. And then Doc Wood went on to teach me some meditation techniques that really have helped, where you close your eyes and you imagine your toes getting lighter and your foot getting lighter and your ankle getting lighter, and they're all kind of floating away, and that's really helped a lot. Then in the midst of working with him in 2012, I was hit by I was involved in an accident caused by a drunk driver, and I'm still having surgeries to repair that damage. This lovely lobster claw came on Tuesday. This was my 7th surgery on this hand, and I'm not sure if I'm done yet. I hope so, but not sure. And when I walked into the hospital on Tuesday morning, they go through this whole rigmarole with the pre-op and all that kind of stuff, and then the anesthesiologist comes in, and he's talking to me, and he's got this amazing sort of British island accent. Turns out he was from Trinidad and Tobago. And he's telling me, he's like, I'm going to do this, and then I'm going to do that, and I'm like, okay, I've been through all this. So they finally get me in the operating room and get me up on the table, and they're strapping me down and putting electrodes, wiring me for sound. And he said to me, well, what you're going to start feeling in a few minutes is some cold medicine going through your IV, not cold medicine as in head cold, as chilly, cold to the touch medication. And I said to him, I'm probably going to be asleep on my own before that starts. And he's like, never happened. I've never had anybody do that. I said, okay. So I started the deep breathing, making sure I was pulling the air as far as down in my abdomen I could get it. I started the meditation, that my toes were getting light, my ankles were getting light, and so on. And in about 2.5 minutes, I was sound asleep on the table before they even had all of the stuff hooked up and wired up and what have you to me. And they proceeded with the meds that they were going to give me and the horrible tube down my throat, and my voice still hasn't come back from it. And after the surgery was over, it took about 2 hours, and the surgeon came back to see me, and the anesthesiologist made a point to come and see me in the recovery room. And he said to me, I've been doing this for 22 years. I've never had anybody fall asleep on my table before I gave them the drugs. He said, what did you do? How did you do it? He said, please don't tell me now that you took something at home. I said, nope. You guys said nothing to eat or drink since midnight last night. I went to bed at 10 last night because I had to get up at 4 this morning. I said, so I had, my normal evening meds at 10 o'clock, and I went to bed, and I haven't had anything since. And he's like, okay, so how did you do it? And I started showing him the breathing and talking through the meditation technique, and he was absolutely, completely blown away at this. He was just like, I can't believe that meditation and breathing put you to sleep. I said, it's taken me 8 years of practicing this stuff. I said, but I'm now to the point where when I'm feeling like I'm having a panic attack driving or as a passenger, I start the breathing. And the breathing is, you have to be consciously thinking about it. You have to be aware of what you're doing. So therefore, it starts pulling all the fear, all the anxiety out of your brain, because that's all really, it's just your brain going haywire and overactive when you're thinking about, oh my God, there's a car almost hit me, and and it just spins out of control. So suddenly, I'm breathing, and I'm purposefully breathing, and I'm breathing so that I'm pulling oxygen down into my body, and I'm aware of how I'm breathing, and I'm making myself pay attention to my breathing. So that sort of shuts up this mini in the back of your head, because your body is now, your brain is now consciously working on a task. That task is breathing. In through your nose, blow it out through your mouth, pull it in, hold it for 5 seconds, slowly blow it out for 5 seconds. It's a really awesome technique. And I'm not going to go much more into the technique because it's Dr. Wood's to teach, not mine. The meditation that goes with it is you start imagining that each part of your body is getting lighter and lighter and sort of floating away. And before you know it, whatever had you in a panic, what had you in fear is gone. And you are calm and you're ready to go to sleep. And believe it or not, once I started sleeping well, balanced my body's pH better than it ever had been, started dealing with some of the emotional eating triggers, and started teaching me to stand up for myself and be who I am in this world and who I want to be in this world, and not a victim. My weight loss journey became easier, okay? And it was no longer, oh, I'm depriving myself of that Hershey bar. It's, no, I'm purposefully eating now. I was, and still practice this to the day. I eat 3 to 4, sometimes maybe 5, really small meals a day. I used to have a desk drawer when I was working that was full of Hershey's, and, oh, Madam Ariel has joined me. I used to have a drawer that was full of Hershey bars, Three Musketeers bars, Snickers bars, Milky Way bars, and I no longer have any of that. Well, I don't work anymore, but from here at home, am I coaching? Because of all the damage that was done from the accident, the doctors decided that I should be on disability. So I did that and started the coaching business as well. And this beautiful young thing here is my significant other at times. Her name is Ariel. She's been with me for 9 years. And where she's sitting right now is where she tends to sit when she wants me to feel better. She's an amazing cat. She has taught me about unconditional love. And for the last 9 years, she's slept with me. She's been with me through surgeries and the accident, and just loved me for no reason. And that's what the world's all about, is loving for no reason. She's taught me what unconditional love means, and now I get to practice it elsewhere in my life. And Dr. Wood also helped me learn about unconditional love and why it's so important. He is a phenomenal coach. I have seen him do amazing, wonderful, unbelievable things for me. And I'm seeing him now at a different level and at a different pace of coaching and chiropractic, and he's really bringing to life his dream. And if anybody ever has any questions about how he coaches, what he coaches, just give me a call. My number is 443-226-3574. I'll be happy to give you a one-on-one testimonial about how great he is, and I owe him my life. We started out being coach and coachee, and somewhere along the line, in the last 8 years, it's evolved into a wonderful friendship, and I think very highly of him, and I recommend him very highly. He not only knows chiropractic, he knows a whole lot of stuff about the brain and the inner workings of the brain, and how the brain can make you feel crappy or make you feel better, and how breathing can calm you down, can help stimulate things in your body, all that. And that's what he coaches and teaches, and he's great at it. I hope you have a wonderful weekend and a blessed month of August. Thank you very much.